Hope you're all getting ready to have a nice weekend. I want to begin today by talking a little bit about the numbers, as I normally do, and then we'll talk about an order that we're expecting to issue later this afternoon, most likely. So first of all, confirmed cases in St. Louis City, 1,770. That is 27 cases. This is from yesterday. 27 cases yesterday, 12 the day before, 23 the day before. So you can see it's fluctuating a little bit. All this often depends on when we receive results from the various labs, when the state receives those results. So still trending down a bit and on a good trajectory. Other news, which is even a little bit better, I think, is currently hospitalized 430 people, which is down 18 from yesterday, and 74 people on ventilators right now. 34 people were discharged from the hospital yesterday. So we're continuing to just to watch all of these numbers. You all know that we cracked the door open to businesses and restaurants opening on Monday, so this would be their 5th day that they could be open. Many restaurants are not open, many retail shops are not open yet because they're all trying to get prepared to make sure that they can comply with the guidelines that are required in each of those industry, and they're just getting their operation back together and calling their employees back and that sort of thing. So we're easing into that significantly. So we talked on Wednesday a little bit about summer camps, summer camps and youth activities for the summer. We're talking about day camps, not sleepover camp here. They will be able to open on the 1st of June if they're ready, if they can comply with the protocols and have the proper PPE and the staffing. It's likely, based on what I'm hearing, that some of them won't open on June 1st. They're going to push it to the 8th or maybe even the 15th, but it gives them some flexibility, gives them an opportunity to get ready to open, to register some kids. Now they'll have significantly fewer kids will be able to go to camp because they have to practice the social distancing and wear masks, hand washing, etc. But it does give some opportunity. We know that parents rely on summer camps in the summer for enriched activities for their kids, good activities to keep their kids engaged and busy, which is very important. And so it's been hard for those parents up to now when we were not able to announce that date. Excuse me. So that is summer camps. We also talked about pools a little bit on Wednesday. Pools will be able to open also on June 1st if they're ready. And it's likely that a lot of them won't be ready because, like our city pools, which likely won't open, they may not open at all this summer. We're still trying to figure that out. But they likely won't open at least for another month because we have lifeguards. We don't have lifeguards hired and they're not trained, etc. But pools can open, and many apartment pools will be able to open, condo pools. Of course, private residence pools could always open. So pools and aquatic center have a window here where they can begin to hire the staff that they need and get their facility ready. The third item to talk about today is we are issuing today, and it's been out on a couple of websites for a couple of days, the guidance and protocols for the cultural institutions, destinations, attractions, large venues. That's a very extensive guidance that we'll have up on our website by the end of the day. And so in addition, for the zoo, for example, or the Botanical Gardens or the Science Center, they not only have to comply with the guidelines, they have to submit their operating plan to us. And Dr. Eccles is reviewing those operating plans now and approving them, getting back to them, back and forth, until they get an operating plan that he believes is an adequate operating plan. And the date for that, the earliest any of them can open is on June the 8th. That's about 2.5 weeks away. And so we will be able to see more about what's happening with our numbers as a result of opening, cracking the door up, open on restaurants and small business and retail. We'll be able to know more about that before June 8th. And we certainly hope that all of these opening dates stick, but we always reserve the right to see what's going on with hospitalizations, and modify that if we need to. We don't want to have to do that, but it's definitely something that we have to keep in mind. And all the large venues know that that's a possibility. So, but June 8th is the date that they can begin to open. As you may have seen, the zoo has announced that they're going to open to the public on June 13th. The Botanical Gardens and Science Center are similar, so there's a window. Everybody has to figure out their operation. And then the last topic, and I know many of you are really interested in this because we get a lot of questions about it, is gyms, fitness centers, dance studios, yoga studios, and those related activities. They will be able to open with restrictions on June the 15th. And those guidelines, I believe St. Louis County we're both using the same date here, June the 15th. I think they put their guidelines out this morning. We'll be putting this out with an order. Our guidelines will be very much the same, if not identical, on all of these. So that is, that's 4 new sets of guidance that will be coming out shortly. We always try to put these out in time to allow the businesses that are in this business time to internalize, figure out how to implement these guidelines so that they can move forward and be ready at the time that they think is appropriate. So that's kind of the news for today. And I think these are the last major industry groups. I'm sure we'll have some questions from folks maybe that can't quite figure out, well, which one applies to me. There is general business guidelines out there, and that's been out there for a couple of weeks now. It's on our website. It's in order number 8. Order number 9 will modify order number 8 in order to include these 4 new sets of guidelines. So, do we have any questions today?
Yes, Mayor.
Good. Thank you, guys.
Selena's question has to do with church, and can you clarify if churches are still limited to the no more than 10 people in a gathering?
No. Churches can open. They could open this past Monday on the 18th, as long as they follow the CDC guidelines, which are extensive and they're online, and they include, you have to do social distancing. Let me give you an example. If there's a pew at church and you've got 3 or 4 people in a family who come together, those 3 or 4 people can sit on one end of the pew. If it's long enough, 6 feet away, someone else can sit on the other end of the pew. 1 people, 2 persons, whatever. They've got to be 6 feet away. Your family can sit together. You live in the same household with them, so that's not a problem. The row behind you should be empty. And then you go to the 3rd row, and again, you have socially distanced folks. So that is, and you have to wear masks. So that's the rules for churches. We also, for churches, really choirs should not be singing together. Somebody needs to do a solo, because you just can't have a group of people, a choir of people, singing their heart out, expelling all that air that it takes in the choir, and putting that error on everybody else. That's not a safe situation. The other thing with regard to churches is no hugging or saying hi to your neighbor and shaking hands. You have to use that little elbow bump or not at all. And that's the way that we've allowed churches to open. By the way, and I've been asked this question a number of times, that would also apply to funerals, for example. Some funerals are in churches, some funerals are in funeral homes, still have to socially distance. And I know that is that's been a heartbreaking and an especially hard thing for people over the last 2.5 months. You will have a much smaller group, but you will be able to have a service, a small service. So,
an interesting question, I think, from Von Treese, who is watching. Her question is can you speak to what the positive cases look like among our youth, like kids 10 to 20?
I don't have those numbers in front of me, but I do know that there are very few cases, kids 10 to 20, but there are cases. And one of the things that I could get for you is I can look that up, and Dr. Eccles can tell us the number of cases. But when you consider that we've got 1,770 cases, it's online, right?
I'm
You're
looking at it
up
right now. So
okay, it's on our website, by the way.
So for females 10 to 19, there
Kyle's got it right there. What do you got?
Females 10 to 19, there are 13 positive cases.
Okay.
And males 10 to 19, there are only 16 positive cases.
Okay, so
it's the smallest age range of positive
yeah.
cases in the city.
So that's 39, right? 16 or 29. Yeah, 29. Sorry, cases in the for 10 to 20-year-olds in the city, to date. So that's out of our 1,770 cases. And I got to tell you, for those of you that are interested, we have a lot of great information on our website. We've got charts, we've got graphs. It's by race, it's by age. And so if you're really interested in digging into some of those details, you might want to go to our website and look at it. The state's website also was recently considerably improved with regard to data.
Paul's question, when you talked about pools, can you specify what the guidance will be for city recreation centers and city-operated swimming pools?
So there's, right now, city pools are not going to open. Because as I mentioned, the guidance would be the same for a city pool as it would be for any other pool. But we don't have any lifeguards hired. And it's possible that we'll open them at some point this summer. I'd like to. I think pools are really an important part of summer if you can do it. But at this point in time, we're not opening those city pools. Now, some of you who know the city well know that we have 2 recplexes that are operated by the Y, one in O'Fallon Park and one in Carondelet Park. And the Y also has not made a decision yet about whether or not they're going to open those pools. The last 2.5, 3 months, that's when you would have been hiring your lifeguards, training your lifeguards, sending them to the Red Cross for lifeguard training, all of those kinds of things, getting your pool ready to go. But we've been on a stay-at-home order. We weren't able to do that. So I don't know at this point in time that city pools, outdoor city pools or indoor pools, for that we have a few indoor pools, will open this summer. Something that we're going to look at.
You've talked about churches and you've talked about large venue meeting spaces.
Mm-hmm.
How does that play into weddings moving forward, and then groups of 10 or more?
So if you read the large venue guidelines, which we'll have up on our website before the end of the day, what you're going to see is that let's say it's a room that normally holds 300 people, and maybe you want to have 200 people at your wedding. You're only going to be able to have 25% of that 300. I should have picked an easier number. What's 25%? 60. Is that right?
I don't know.
60,
You're the
60,
CTA.
120, 240. No, 75, sorry. 75 people would be all the people you'd be able to have in a room that would normally hold 300 people. And so there are some pretty strict limitations, but you can have a small reception. You can have a wedding at a church. Again, it'll have to be small because you'll have to socially distance. But you can have small events starting after. You can do the wedding now and wait for the reception, but starting after June 8th, if your venue is ready to go. You won't have the round tables with 8 people seated around it. That's a no-no in the new guidelines, because it's just not the way to keep people socially distanced.
So a follow-up question from Lauren, Mayor. She wants to know about further along down the summer, like in August, do we anticipate higher capacity limits and fewer restrictions on some of these venues and spaces?
You know, Lauren, I wish we all knew we all want that answer, but we don't really know it right now. It depends on what happens. Depends on whether or not we see an increase in hospitalizations, an increase in people in ICU and on ventilators. If we see that, we will have also seen a big increase in cases. So we don't know the answer to that. We are hoping that everybody restrains themselves, continues to wear their masks, and socially distance, and that we don't have an upward trend. But we really don't know. I would say this to you, I hope so. I hope that by August, that's 2 more months, I would hope that by August we would be able to have more than 25% capacity at our venues and our cultural institutions, but I just don't know the answer to that.
2 questions, one from Tanya and one from Devin. Same topic though. Do you anticipate additional testing to be made available soon for people who are not representing any symptoms of COVID-19?
Yes. That's one of the things that we've seen over the last week, a little more than a week maybe, and you can see this on the state's website in particular, and that is the state shows the number of positive cases and the number of negative cases, and you can see that the number of tests is really going up. You can also see when you turn on the news and your federally qualified health centers can give tests, some of the labs can give tests. There are a couple of mobile vans. So yes, tests are finally, just this week really, becoming more available. And so more people are able to be tested. And there's 2 kinds of testing, you know that probably. One kind is the kind that says, it's a diagnostic test. Do I have COVID-19 right now? And that's a swab, nasal swab, goes into a tube, goes off to the lab processes it. It takes anywhere from 2 days to 10 days sometimes to get that back. The other kind of test, it's also done in hospitals, by the way, but I'm assuming that you're not in the hospital for this test. The other kind of testing that some folks are doing out there is the antibody test that says, have I had it? Do I have the antibodies? Have I had COVID and I don't know it? Now, those tests are out there. I know people who have had them, and they are not as reliable, but they are some information. So, and you can also get those tests. I know that the Total Access Urgent Care, I think, is doing those tests. I saw that. So there are a number of places, and now you can get tested, and testing is free. So if you wanna get a test, you got to call first. You can't just show up. You got to call. Walgreens is even doing some testing. So that's all causing its own difficulty in terms of reporting and timely reporting. So now you got a lot more people in the space, and they're all supposed to be reporting into the state. But nevertheless, it's an opportunity, and it's something that we definitely need. We have needed it. You've all heard me talk about this for 8 weeks. We don't have any tests. Well, now we finally are having some tests. The city got 20,000 tests. We have used all of those. We got those tests, 2 weeks ago, maybe a week and a half ago, something like that. And we're expecting to get another big shipment of tests here we hope next Friday. And I say it in that way because we've been disappointed many times on when our orders were supposed to come in. So I don't think anybody's doing that intentionally. It's just that, you know, from everything from just a simple mask to gloves to gowns to shoe covers to face masks to tests, you know, we just did not have the supply in this country. And one of the things that you might hear talked about for those folks out there that might be in know about this, it's something called just-in-time inventory. It's been the thing that manufacturers and hospitals, everybody did it. You wanted to order your supplies just in time so they would get there at the right time for you to use them. And that's really a good method if there's sufficient supply. It's a good method because you don't have to have a big warehouse full of inventory. You don't have to pay for something this month and not use it for another month or 2 or 3. But when you come into a crisis like this, almost no matter what business you're in, this just-in-time shipping is just not quite in time. So I think everybody's rethinking their, how they're going to do that. But it's interesting. So there are enough tests now.
A question from Brett, who's inquiring about organized sports leagues and if that is available by any of the new dates that we've announced.
Depends on what they are, Brett. If they're non-contact sports, I'm going to pull this out so I can refer to it for you. Then, yes, tennis is a non-contact sport. They might have a league. If it's soccer, no. Basketball courts, no. Racquetball, no. So it depends on what the sport is. The short answer to that is not many. Not many. Not right now.
Sharita's question is, can you speak about what the plans might be looking like for the upcoming school year?
Where everyone's trying to figure that out. You've seen some colleges and universities announce, some have announced, okay, we're going to be online. Others have announced, we're going to have classes. All of these announcements are somewhat tentative because nobody really knows exactly what's going to happen. I certainly hope that kids are able to go back to school in the fall, whether that's August 10th or September 1st or what the date is, I don't know. It will really just depend on what happens this summer. If we all continue to socially distance, to wear masks, to wash our hands, to be careful, and we don't see a big uptick in the number of cases or in the number of people that are seriously sick and in the hospital, then I think it is likely that schools may open this late summer, early fall. But that is just a guess right now. And frankly, it's not even a decision that I necessarily get to make. The school systems, Dr. Kelvin Adams in the city of St. Louis and the charter schools and the parochial schools and the independent private schools, they'll all make those decisions. But I think, they need more information than they have right now before they can make that decision in most cases.
2 questions about contact tracing, Mayor. Lisa's wanting to know, is the city considering hiring contact tracers? And if so, another question from someone is, how do we go about applying to maybe be one?
So the city will be hiring additional contact tracers. We don't have that position posted yet on our website, but when we do, you will be able to apply through the city website. There's a little tab on there that says, work for the city or something like that. You'll be able to apply online for that. We are doing fine now with regard to contact tracing. I'm sure you've all heard this because we have a lot of the process automated. Not all of it at all, of course, but we do have a lot of it automated. And so we're doing fine right now. We also, one of the distinctions here is that sometimes you have an outbreak in a congregate facility, whether it be a nursing home or a children's home or a group home, those congregate living facilities. And when that is the case, then that facility is doing the monitoring of those people that are within that facility. Let's just use a nursing home as an example. Two positive cases in a nursing home is considered an outbreak. And that nursing home, of course, is visited by us. They've all been visited by us already, more than once. We make sure they have PPE, that they know proper infection control, that sort of thing. But then they would have a lot of very serious information that they would have to report on however many people were in that nursing home. So yes, we will be hiring more contact tracers, and you would apply online.
2 City Hall, city employee related questions.
Mm-hmm.
The first of which, will all city offices at City Hall be open? They're asking, Charlotte's asking this week, but since the week's over, maybe next week.
Yeah, City Hall's gonna be closed for the holiday. But Charlotte, all the offices at City Hall are already open, and they never completely closed. Every office has been providing service. A lot of that service has been provided online. We did not allow visitors. We are not allowing visitors right now into City Hall. We're going to start that on June the 1st. But you could still come and drop something off at City Hall during this entire time. The doors have not been locked at all. That said, we do expect to begin having visitors in our city buildings, whether it's City Hall itself or 1520 Market or our other buildings, on June the 1st. Everyone will have to wear a mask who comes into City Hall. Let's just say that maybe you're coming to renew your license plate or your driver's license, because that's a busy office. And they plan to reopen June 1st. First thing you should do is try to do it online, because most people can do it online. And if you're watching me on Facebook, which you are if you're hearing me, then you have access to either a phone or an iPad or a tablet or a computer. So you can do a lot of this online. If you do need to come to City Hall for some reason to get that done, then you'll come to the front door. We'll take your name, we'll take your phone number, we'll take what is it that you need to do at the license office, and we'll ask you to wait in your car, and we'll call you when your number comes up or when it's time. So we're doing that in order to try not to have big crowds of people in City Hall. The DMV office, Department of Motor Vehicles office, is ordinarily an extremely busy office. And so we're just really trying to make sure that we're able to space people out. You will see when you come, if you come and you don't do it online, you will see that there are plexi screens, there's hand sanitizer, there's spread out seating for the few people who get to wait. So it'll be different, but that's a long answer to your easy question, I guess.
An interesting question from Aaron, who's curious about what the impact of coronavirus has had on the 2020 census and the turnout in the city of St. Louis.
That's a good question, Aaron. The stay-at-home order, you might think that if people were staying at home that they'd fill out their census, but actually that didn't happen. And so we know that we are somewhat behind in getting our census numbers in, and the census is so important to us because many federal dollars are allocated to a city or a county, a region, based on what their census is. So if you don't fill out your census, then we will get less in terms of federal dollars for whether it be homeless services, whether it be block grant monies, all kinds of funds. So please do fill out your census. You go online and do it. You got something in the mail which gave you a PIN number. And the census has been pushed back about 6 months. I don't know the exact.
That adapting our expressions of faith to find our way through challenging times is one of the most faithful acts of all. May you find joy and togetherness in this blessed weekend. Thank you, and I'd like to turn.
And let me join the governor in wishing our Muslim brothers and sisters Eid Mubarak as they end again this Ramadan season. We also are heading into the Memorial Day weekend, and so I know in the absence of parades, we still want to find ways to honor and celebrate those who've given their lives while serving this country, again, in a safe and socially distanced way. We continue to increase our testing capacity across the state, and the number of tests being performed each day are just a sign of the hard work that has gone into increasing our capacity and understanding the importance of testing as we overcome this pandemic. I can't thank Governor Pritzker enough for his rapid response to ensuring that we elevate our state's testing capabilities. To date, nearly 700,000 tests have been run, with 25,113 being reported in the last 24 hours. Over the last 24 hours, 2,758 new COVID diagnoses were identified, which brings our total confirmed cases in Illinois to 105,444. Sadly, we had reported through IDPH 110 additional individuals who lost their battle with COVID, for a growing total now of 4,715 deaths. As of last night, we had reported to us that 3,928 individuals were in the hospital with COVID-19, and of those, 1,060 patients were in the ICU and 589 patients were on ventilators. Sadly, thousands of Illinoisans are dead from COVID-19, and many families and friends were not able to visit their loved ones or be there when they passed. And another nearly 4,000 people are in the hospital right now fighting for their lives. Those are truly heartbreaking facts. I know this weekend is supposed to unofficially kick off the summer season, and that traditionally included graduation parties and pool openings and the like. So although it's unfortunate that we can't throw a barbecue with 100 of our friends, I think it's clear why we are in that situation. And I know that you're doing your part to make sure that we will get to celebrations that we can celebrate with more normalcy in the future. This is not an easy time, but until we have a vaccine and reliable treatment, we need to learn how to coexist with COVID. The virus is still out there, and your individual human behavior, including wearing a mask and keeping 6 feet of distance, those are the weapons that we have right now to overcome this virus. Let's continue to hang in there. Let's do the right thing. Let's continue to stay all in for Illinois. And with that, I'll translate my comments into Spanish. Feliz Viernes y Eid Mubarak. Empezando este fin de semana del Memorial Day, espero que pueda encontrar formas de honrar y celebrar a los que han dado su vida sirviendo a su país en una manera segura y socialmente distante. Continuamos aumentando nuestra capacidad de pruebas en todo el estado y la cantidad de pruebas hechas cada día. Lo he dicho muchas veces, pero no puedo agradecer al gobernador Pritzker suficiente por su rápida respuesta para elevar las capacidades de prueba en nuestro estado. Hasta la fecha reportó 25,113 pruebas hechas en las últimas 24 horas. Desde ayer, 2,758 personas han sido diagnosticadas con COVID-19. Ahora tenemos 105,444 casos confirmados en total en Illinois. Desafortunadamente, esto incluye 102 personas adicionales con COVID-19 que han perdido la vida, para un total de 4,715 muertes. Hasta anoche se informó que 3,928 personas en Illinois fueron hospitalizadas con COVID-19. De ellos, 1,060 pacientes estaban en la unidad de cuidados intensivos y 589 pacientes estaban en ventiladores. Miles de habitantes de Illinois están muertos a causa de COVID-19. y muchas familias y amigos no pudieron visitar a su familia o estar cerca cuando pasaron. Casi 4,000 personas están en el hospital ahora mismo luchando por sus vidas. Esa información es difícil de escuchar, pero es nuestra nueva realidad. Piensa en eso y no te enojes porque no puede hacer una carne asada con 100 de sus amigos. Sé que se supone que este fin de semana comenzará oficialmente la temporada de verano con fiestas de graduación, abriendo de piscinas y demás. Pero cuando se enoja pensando en las cosas que no puedo hacer este fin de semana, la próxima semana o incluso el próximo mes, recuerda los que nunca podrán volver a hacer nada de eso también. Esto no es fácil, pero hasta que tenemos una vacuna y un tratamiento confiable, debemos aprender a convivir con COVID. El virus todavía está en nuestras comunidades. Debemos seguir usando una máscara y mantener una distancia de 6 pies entre las personas. Son nuestras armas que tenemos ahora para combatir este virus. Sigan luchando con nosotros y pronto regresamos a una nueva normal. Muchísimas gracias. And with that, I will turn it over to Governor Pritzker.
Thank you very much, Doctor, as usual, for your regular medical update and all the work that you're doing on behalf of everyone here in Illinois. I want to wish everyone a happy and safe Memorial Day weekend. All of Illinois appears to be on track to move into Phase 3 of Restore Illinois next Friday, allowing hundreds of thousands of Illinoisans to go back to work in the industries that are eligible to reopen in the weeks ahead. Safety is of utmost importance, and we're working with industry associations and businesses, employees, and doctors to make sure that we set strong health compliance standards to keep everyone safe. But we can't have a conversation about going back to work without talking about childcare. If we don't have childcare, a large portion of the workforce, especially women who too often bear a disproportionate burden, will be without any way to move forward without caring for their child themselves. From the start of this public health emergency, Illinois has recognized the importance of childcare for working families. We focused especially on essential workers continuing to work outside of the home. And for that reason, we included childcare in the list of essential businesses, starting with our first stay-at-home order. And over 2,500 childcare homes and 700 centers have been providing care over the past few months. That's about 15% of the previous operating capacity of our childcare system. When I issued the stay-at-home order, we implemented an emergency child care system that provided access to child care in small group settings for essential workers, people who ensure our public safety and help others, families to get food, gas, pharmacy goods that they need. And I'm particularly proud that Illinois made sure that all essential workers, from nurses and doctors to grocery store clerks and food producers, were eligible for the state's child care assistance program, meaning the state covered most, if not all, of the cost of child care for our emergency child care providers and for the essential workers who use them. And to help keep emergency child care centers up and running, the state offered a one-time stipend and paid enhanced reimbursement rates for emergency child care for 30% above what we usually pay to reflect the additional costs of providing care in smaller settings. In sum, we've been focused on supporting essential workers and protecting the health of children and child care staff. And I'm pleased to say that this approach has proven successful. To date, Illinois has not seen significant transmission of COVID-19 in child care settings, which is encouraging evidence that child care can be provided safely. Public health experts emphasize, however, that there is much that we still don't know about this new virus, how it spreads, and especially what effects it has on children. Therefore, moving forward, Illinois must take a cautious approach that appropriately balances the need to greatly expand childcare with the need to lessen the risk of spreading coronavirus. We gathered input from over 80 stakeholders from all around the state, including child care providers, child care resource and referral agency staff, legislators, advocates, state agency officials, and of course, public health experts on everything from new health and sanitation protocols to staff training needs, to what supports families will need as they return to child care. Their insights are reflected in the plan that my administration is issuing today, shaping our roadmap for safely increasing access to childcare as parents return to work. Following the guidance, all of the 5,500 child care providers who are not currently operating are being asked to reopen when their community moves into phase 3 of the Restore Illinois plan. For the first 4 weeks that they're open, providers will be able to serve no more than 10 children per classroom. Once they have provided care safely for 4 weeks and have gotten accustomed to the new health, social distancing, and sanitation routines, they will be able to expand to larger group sizes, though not yet their fully licensed capacity. On the strong advice of public health experts, these new group size limits will be roughly 30% lower than the levels they were at before the pandemic. For our licensed homes, which tend to be smaller, most will be able to operate at standard capacity. With all centers and homes online, this would bring us to more than 3/4 of our previous child care landscape in Illinois. Providers that have been successfully operating as emergency child care providers can move immediately to these new maximum capacities when their region enters phase 3. Most licensed child care homes will also be able to reopen to their licensed capacity. Recognizing children's need for quality early learning experiences, all providers will be expected to resume compliance with all licensing standards related to curriculum, learning environment, and staff qualifications. Already, we've made significant investments in maintaining Illinois' vast child care network during this crisis, implementing a simple waiver process to allow providers to be paid for all of their enrolled children in the Child Care Assistance Program for March through June, so that child care staff could continue to be paid as normal through this unprecedented period. And for emergency centers, we increased the CCAP money that providers would get for each child. But there is more to be done, and we are working on developing appropriate business relief funds that will help to minimize the impact of these necessary restrictions. That is work that we're already doing at the state level with the help of CARES Act dollars. But it's crucial that the United States Congress amplifies its support for our national child care landscape in an upcoming relief package. It doesn't matter whether it's a red state or a blue state. Every state is home to providers who need real assistance in sustaining their business through the coming months. And every child in every state deserves access to quality child care and early learning services. We all want a stronger, more equitable America on the other side of this pandemic, and it starts with our children and their earliest experiences. This is how we begin to build that post-COVID world. Now, before I take questions, I want to take a moment to offer additional insight into some of the changes coming in phase 3 of Restore Illinois, which it looks like will be 1 week from today. In the coming days, my administration will be releasing specific industry reopening safety guidelines that combine public health expertise with the creativity of our people to find a way forward. Similarly, my team and I have received a lot of excellent proposals and ideas from different religious groups on how to safely expand their services. Let me address that specifically. From a broad standpoint, I can say that outdoor faith services, including but not limited to drive-in church services, will be welcome in Phase 3. And we continue to collaborate with faith leaders to ensure that they can hold services in safe and creative ways that allow for worship while protecting their congregants. I know worship is as essential as food and water for most of us, and it's my priority to provide guidance to ensure that it can proceed safely. Thank you, and now I'm happy to take questions from members of the media.
Dave, we'll start with you.
Dave, good afternoon.
Good afternoon to you, Governor. Thanks. John O'Connor of the AP asks, the budget in the House is $5 billion or more unbalanced. How much federal funding are you counting on to fill the gap?
Well, we don't know what the federal government's going to provide, but we believe that at least the two proposals that have been made in the Senate and in the House each provide for enough so that we will be able to fill the hole that's been created by the tax revenues lost during COVID-19.
You anticipate they're going to have to come back once we know how much federal money is coming our way?
I don't think
the legislature.
I don't think that we will. As you know, the hole that's being filled is MLF dollars, and those dollars would simply be repaid with the dollars that come in from the federal government.
Rich Miller, Capitol Facts. What do you know about the progress of legislation to codify a modification of your repealed IDPH emergency rule?
Well, my understanding is that legislation, though there's still a possibility that it may go through, is something that the legislature does not appear to want to raise and hold a vote on. I haven't heard the latest. I'll be very disappointed. I mean, the legislature has been asking for months and months. They've wanted to come together because they consider themselves, and they are, a co-equal branch of government, along with the judiciary branch and the executive branch, and it is their obligation, frankly, to do their duty. They don't seem to want to help in any way dealing with the COVID-19 crisis by offering us the ability to use a small enforcement mechanism that we've asked for.
Peter Hancock, Capital News, Illinois, asks, with the budget package that is out there, it appears you would have pretty broad discretionary authority over a lot of spending decisions. Can you give details about how you would intend to use the authority, what your priorities are, and how Illinois would pay back the short-term borrowing, $5 billion?
Well, I talked about the short-term borrowing just moments ago, so I'll just address the rest. Look, I put a budget forward back in February. I think everybody understands what my priorities are for the state, and I'm going to follow those priorities going forward.
Kelly Bauer of Block Club, how will the state provide more child care for parents as they return? I think you already addressed that.
Yes, I did.
The 2,650 emergency daycares are not enough to care for the vast majority of children here, if you want to expand on that.
No, I think I talked about it a little earlier, but it's a great question, and that's why we addressed it today.
Jim Leach, WMAY, when do you expect the State Board of Education to offer guidance to local districts on how to proceed with fall classes?
Well, again, I think we're all subject to the challenges of COVID-19. It's still unclear whether we're going to see a spike, what challenges we're going to see over the summer. We'll try very hard to give guidance as we have it, but truthfully, this is going to be guided by the science and the data, and it's unclear because as you move forward, the data and the science, first of all, the science is evolving, and the data is giving us more information about what we ought to be doing. So short of waiting to the fall, which we won't, we'll be giving as much guidance as we possibly can.
Earlier today, Leader Bill Brady of the Senate said that everybody ought to stay in town. He doesn't want to go home. Legislature and the governor continue to talk about the Restore Illinois so there is enough legislative input. What do you think of that, as well as his statement that, yeah, I talked to the governor, he listens, then he does what he wants anyway?
Well, that's Bill knows better. The truth is that I've talked to many, many Republican legislators. You've seen changes that I've made along the way. Many of them have been recommended by Republican legislators. And as to staying in town, look, again, they're a co-equal branch. The legislature has the ability to do that. They're doing quick work. I also think they want to make sure that everybody is safe. You saw that there were some legislators who could not even come because they have comorbid conditions. And so, we want to make sure that everybody gets out of Springfield when they do in a safe fashion. But look, it's up to them, and I'll be here.
Rebecca Anzel, Capital News, Illinois. President Trump has declared houses of worship essential. What are your plans for churches, synagogues, mosques, and other institutions? What are your thoughts about President Trump's threat to overrule you?
Well, we're going to continue to operate on the basis of science and data, and I'm as anxious as anybody to make sure that our churches, our mosques, our synagogues open back to where they were before COVID-19 came along. We're gradually moving in that direction, but there's no doubt the most important thing is we do not want parishioners to get ill because their faith leaders bring them together. We hope that faith leaders will continue to do as the vast majority of them have done, which is to worship sometimes online, sometimes in other capacities, as we've talked about, outdoor and drive-in.
Bill Ruthart, Chicago Tribune. Mayor Lightfoot has said she wants to be able to offer Chicago restaurants the option of indoor dining in June, saying the city's poor weather and desire to give owners the ability to generate enough revenue to help keep them afloat. Is this something you're willing to reconsider, or will the mayor and Chicago restaurants have to wait till phase 4?
Well, I too would like everything to reopen in the fashion that it was at before. Again, what I'm being advised by the epidemiologists is that indoor dining, at least during this next phase, we need to be extraordinarily careful, watch the numbers. With outdoor dining, with the servers who will be wearing masks, but the people sitting at tables may not be, and of course the food has the potential to carry the virus. So we just want to be very, very careful and watch what happens with the opening up that we've already allowed in phase 3.
Mike Miletich, Quincy Media, IDES, has sent out a release about the data breach investigation. Representative Terry Bryant says no one's answered her questions about what happened. She doesn't believe only one person saw the information. How can you or the department be certain that only one person saw that personal information?
Well, they can look at the log data, but here the IDES has been extraordinarily careful and taken extra precautions here by making sure that the contractor has provided for more than 35,000 people the ability to track their own credit reports to make sure that nothing goes wrong for them.
Charlie Meyerson, ChicagoPublicSquare.com. It's been more than a month since two lawyers married to one another, Leslie Ann Jones and Thomas Johnson, were murdered in their Oak Park home. More than a month since state police joined the investigation. We've heard almost nothing. What can you tell us about that case?
I don't have details about that case, but happy to refer you to the state police for that.
And a question from my colleague Scott Mulford at WTAX. It's known that you communicate with Cardinal Cupich. Have you had direct communication with any other Illinois bishop, specifically the one here, Bishop Thomas John Paprocki?
I have not heard from Bishop Paprocki. I have spoken with a number of bishops and pastors. Just this morning, spent about a half an hour on the phone with a pastor, and that's a regular occurrence for me, frankly, including of all faiths.
I think that's all I have, except for ones that Taman also has.
Okay. Come on.
Welcome back, Taman.
Thank you, Governor. Appreciate it. We've been talking about it for weeks, the impact the virus is having on African Americans and Latinos. There's a new poll out this morning showing blacks are nearly 3 times as likely to personally know someone who died from the virus than white Americans. Why isn't the legislature doing a bill to help address the COVID-19 racial divide?
I can't speak to why the legislature and what the legislature would have done with a bill, but I can say this, that statistic that you cited doesn't surprise me. The African American community, honestly, has had the greatest toll brought up against them in terms of deaths. The comorbid conditions that often exist in the African American community because of historical racism, because of the failure to provide the right kinds of health care in the community are some of the reasons why that exists. Now, of course, we're working very hard to protect people in communities of color, African American community, the Latino community, by providing testing, by doing contact tracing, by making sure that we're educating people about how important it is that they follow the rules, that they stay at home, that they use face coverings, and so on.
It's going to be a warm Memorial Day weekend in Chicago under the stay-at-home orders. What's the state police's plan to help Chicago and other cities keep residents safe? Separately, a concerned viewer wanted to know if authorities have noticed drag racing on the Edens and Kennedy Expressways late at night near Chicago. I've noticed it too, cars going 100 miles an hour.
Yeah. Unfortunately, as you know, that's been going on for some time. The state police have been trying to track down those people who are committing those crimes. In terms of the broader instruction or guidance for law enforcement, I think they're well aware that this is going to be a difficult weekend, that there are people who, maybe not purposely, but just by virtue of it's Memorial Day weekend, people have an extra day off. They're used to getting together with their friends and so on. I really want to provide a caution to all the people who are listening to please remind your friends and your family that I know that this is an unusual time. I ask you to take unusual precautions, wear your face coverings. That may be the most important thing I can say to you. Wash your hands. Make sure you're not gathering in large groups with one another. It is time for us to do something unusual. Keeping each other safe is the most important thing that we can do, and so following those edicts or those suggestions anyway will keep your friends and family safe.
Let's talk about the Chicago Casino from Greg Hines and Mike Flannery. Are you prepared to support a Chicago Casino bill, and do you expect one to be approved today?
Yeah, I was very clear, I think, yesterday about support for the Chicago Casino bill. I think it's very important not only for the city of Chicago but for the state, and so I'm hoping that the legislature will do as I think it is desired to do by them, and so I'm looking forward to signing that bill.
Have you been part of the negotiations? How quickly would construction start, and when would the money start flowing to troubled pension funds for Chicago first responders?
I can't answer all those questions, but I can say that, as you know, I've advocated for this casino since the very beginning. I want to make it work for the city of Chicago. We set the basic parameters for this bill, and so there may be aspects of it that are still being worked on even this afternoon, and our team is certainly tracking that. But the basics here are still intact, and those are the things that are most important about it.
I wanted to follow up on Leader Brady's comments. This comes from Rick Pearson. Do you think there is a Republican strategy at play here with the coronavirus, hoping to seize on the growing frustration of the stay-at-home orders as a play for GOP votes in November? You seem to be trying to counter it by linking Republican lawmakers to fringe anti-Semitic protesters, accusing them of trying to suppress voting by opposing vote by mail and favoring budget cuts regardless of the coronavirus.
I didn't link Republican elected officials to Nazi demonstrators. They linked themselves. There were elected officials that are in the Bank of Springfield building right now who are out there speaking in front of the crowds that were holding pictures of Hitler, swastikas, and they knew they were there. They were holding up signs that said "Death to Tyrants," and then they had other signs that depicted me and Hitler. So I would say that the Republicans have tagged themselves, and for as long as they do not call out the elected officials of their own party, they are a part of the very problem that is existent in this country of allowing hatred and bigotry to perpetuate.
From Mark Maxwell, the same Clay County Circuit judge who called your coronavirus restrictions unconstitutional is hearing a lawsuit today that could overturn your executive order statewide. Considering this is Memorial Day weekend, what options do you have in the event the judge does strike down your order? And do you worry a defeat in court could signal to everyone that it's a free-for-all?
Now, it's clear that the judge in Clay County has his own political agenda. I can also say that the decision in that court, if it goes against us, really only applies to Clay County because it's been decided already in Cook County Court. It's been decided already in Sangamon County Court, upholding my ability to issue disaster proclamations and executive orders associated with a disaster in the state of Illinois.
Tiffany Lipinski, Channel 2 in Chicago. The legislature is not going to do anything to waive penalty weeks that are denying people employment benefits. That tells us there's information the governor can take on penalty weeks without legislative action. You've previously said that that's not true. It requires a law change. Bottom line, are these people need help? What are you going to do?
Well, again, we've been working with the legislature. I hope they get this right this afternoon, but this is on them right now.
Let's see here. Brad Edwards, also Channel 2. For the past 2 months, you've ruled the state single-handedly, including threats to local officials who disobeyed your stay-at-home order. Why now are you giving local politicians so much leeway when it comes to something as important as health-centric as reopening restaurants? Why
Well,
now?
we set guidance, yeah, but to be clear, we set guidance so that's not like, it's a free-for-all here. We set guidance at the state level, and then at the local level, they're allowed to do something that's more stringent, and I understand there are places where they want to do that. Why now is simply because we're listening to the epidemiologists, the doctors, looking for, how could it work safely, and if we can get something done in a safe fashion where we don't think this is going to significantly increase the number of people who end up COVID positive, it's something that we want to allow everybody to do. The whole idea here, just to remind everybody, everything that we're focused on is about keeping people safe and healthy. That's it. And if we can keep people safe and healthy and they can go about their business, that's exactly what I'd like.
State records show 1 in 5 people living in state-run developmental centers have tested positive for COVID-19. That's double the infection rate seen in other long-term care facilities. Some people have raised concerns about smaller facilities where the state does not collect data. What support are you providing for the large and small facilities?
Well, we've been very careful about those facilities, and this is very difficult. There's no doubt about it. Look, everybody knows it's all over the country, right? Every congregate facility is at risk. And so there's guidance that's been provided by the CDC and that is being followed by our IDPH to make sure that we're keeping everybody as safe as we can. There are private providers that are, frankly, some of them of concern, and so we've tried to stay on top of them. We've delivered PPE to all of the facilities all across the state. We've made sure we provided training to everybody at those facilities so they know how to use the PPE, and guidance about how to separate the population, and testing. That's the biggest thing we can do. Make sure that we're testing and then segregating the population according to who's ill and who's not ill. We're trying to get to everybody. Again, even just looking at the nursing homes, there are 1,200 plus nursing homes. Trying to get to all of those in a very short period of time is a relatively difficult thing. We've been building up our testing capacity so that we can go do that. And indeed, we are ratably getting that done.
How late do you expect the legislature to go, and is your plan to stay here until they're done?
That's my current plan. I don't know how late that they're going to go, and if they end up with all of the major pieces of legislation done, and it's really down to some minor issues, maybe I'll leave earlier, but I doubt it. I've been here, as you know, last year. I was here for every last minute of the legislature, and I intend right now to do that.
Thank you, Governor.
Thank you.
We'll go to some questions online. We only have a couple. Tony Arnold at WBEZ, do you agree with the approach Mayor Lightfoot is taking in not reopening Chicago's economy with the rest of the state?
Again, we've left this up to local officials to make decisions that are best for the people who live in their communities. We've tried to set a standard of safety and health for the entire state, and we've done it, as you know, we have a regional plan. So as far as I'm concerned, the decisions that get made at the local level are, in fact, up to those local elected officials, as long as they're maintaining the proper health and safety standards that we're setting.
Jim Haggerty at Rock River Times is asking, some law enforcement agencies have received letters from FEMA warning them that relief funds could be denied for not enforcing the executive order. Were these letters sent before the amendment making violations a crime was removed?
There was not a timing set for a letter like that. I'm aware of the letter. It's a letter really about making sure that people understand that they won't get FEMA reimbursement if they don't follow the rules that the federal government set out.
Haiti Clotter at Fox, Illinois. Governor Pritzker, what is your response to State Senator Chapin Rose after he collected feedback from local leaders across 10 counties as they shared their fears for their communities and the timeline concerns between each phase? Have you gotten a chance to read those letters, and what's your response?
I'm not sure if that's something I've received recently. I've received a lot of plans, and I can't specifically identify the one that came from Senator Chapin Rose. As you know, I'm trying very hard to read and listen to all of the ideas that come from across the state. Indeed, we've incorporated many of those ideas into the executive orders as we've moved forward. So I look forward. If I haven't seen that one, and I'll go back and make sure that I do. If I haven't seen that one, I will make sure and do it. And again, one more thing. The opinions of local officials about how it can operate, how this can operate better in their local areas, does have an effect on the way that I think about, how we should put these orders going forward.
Marnie Pike at the Daily Herald. Will children need to wear masks at child care centers?
No, so the requirement here is that any child that's 2 and under is not required to wear one. We have actually a smaller group requirements for those very young children than we do for slightly older children. Yes, older children are going to be asked. Obviously, if they aren't medically able to wear a mask, then they don't have to. But again, the more people that are wearing a face covering in a group setting, the better.
And Marnie had one more question about, will Arlington Park and other tracks be able to open with spectators this summer?
The bigger challenge in that question is the spectator question. We're still working on what the guidance might be for them to be able to run races. We want people to be able to enjoy watching races. That can be done remotely. You've seen that the major league sports are doing that, or at least they're attempting to do that. So we'd like other sports to be able to. Again, we just want to make sure that folks who work in the backstretch and everybody that's involved in it is kept safe.
Amanda Vinicky asks, what evidence do you have that coronavirus can spread through food? CDC does not seem to indicate evidence for that.
I guess I can't speak to all of the reasons, and it may be that it's more around the plates and the other items that are being served. So perhaps Dr. Ezike can address this. The fundamental reasons why restaurants and bars are more difficult.
More difficult. So the CDC actually did just update their guidance regarding the transmission, the spread of the virus. And so their emphasis is that spread is happening particularly between people. So yes, we know that there is some measure of resulting in infection, but the majority is in